Sometimes your person can help, but not all the way. We call this minimal assist. And in that case, you need to help them a little bit, but still this person can follow commands and can participate. Remember that we want the person to be able to do as much as they can on their own. Okay, so still the same principle. If your patient isn't exactly parallel to the bed and on the side you need them to be, we can use the pillow and the pad to help her move over. Okay, so Caroline, I want you to move towards me. I want you to bring your head and your shoulders towards me a little bit, okay? Now she's going to have a little bit of trouble, so we're gonna count to 3, and we're going to have Caroline help me. I'm going to put my arm under her head and use the pillow and ask her to move with me. Okay, move with me. Come towards me. Come towards me. Good. Come towards me. On 3. 1, 2, 3. Good. Okay. Now I'm still having trouble getting her hips over, so I'm going to pull on her hips also. It takes a little bit of muscle, but she's helping me, so it shouldn't be too much weight. Okay, Caroline, come towards me. Come towards me. Good, good, good. Oh, I forgot to tell her, use your legs, bend your legs. Okay, bend your legs. Okay, come towards me. 1, 2, 3. Now I'm going to pull on there. There we go. Okay, there, we got it. Okay, now she's on my side. I should have plenty of room to turn her over. One thing I should mention is that you want her to be able to roll over so that her head's still supported. So you want to lift your head, Caroline. Okay, we want to move the pillow so that it's a little bit further that way so that she can have some support on her head when she turns. Okay, now, Caroline, we're going to turn on the side, okay? I'll help you, all right? Bend your knee. Now tap on the body part you want her to move so that there's no confusion. Bend your knee, bend your knee. Now she has a little trouble. I'm going to just lift up under her leg and help her bend her knee. Okay, now face the rail, Caroline, face the rail. Okay, reach with this hand, reach for the rail. Good. You always want to have a rail if somebody needs a little help. They need something to grab onto. You can get some aftermarket rails at Walgreens to slip under beds if you don't have a hospital bed, but you need something for them to grab onto to pull, okay? So, okay, on 3, Caroline, pull over, roll over, roll over. Now, I can just push just gently, and it's not a whole lot of weight, right? So I'm just pushing very gently so that I can get her all the way over. It's very hard to position somebody correctly unless you can get them all the way over, okay? So now she's all the way over, and I can put the cushion in and proceed. But let's say that, Caroline, roll back over. Let's say that she can't help you much at all, and I find myself going like this. You know, if I'm pushing, I can't get her over. That's too much weight. It's too hard on everybody. I want to go to the other side where Kelly is, and we want to do it from there. So, okay, let's say that's the case.
So, Caroline, bend your knee.
She's bending her knee and tap, tap, tap.
And use this arm to reach for the rail.
Face.
Me, face me.
Now, Kelly can actually pull on the sheet here and get her whole body over. She's going to look up. Right. Okay, good. So now there's not much weight, and she's pulling the weight closer to there. She's holding her hips a little bit to prevent her from flopping back over. And you can even say, stay there, you know, stay there, Caroline, stay there. Then, now she can come around to the right side. You don't want to reach over to try to place the cushion if you don't have to, okay? All right, and then she's placing the cushion. Okay, roll back over, Caroline.
Roll back over.
There you go, good. And then we can proceed putting the pillow between her legs and everything else we need to do. Okay, great. All right.